Everybody situated? Okay. Good afternoon. Thank you for attending our latest update on the 2019 novel coronavirus, COVID-19. Thank you very much for coming back at 4 o'clock. I know that this was originally scheduled at 2:30, so thank you for your patience. With me today is Secretary Rivera from the Pennsylvania Department of Education, Dr. Sharon Watkins, who is our state epidemiologist, Ray Barashensky, Deputy Secretary for our Community Protection Deputate, and Director Randy Padfield of PEMA. As of this afternoon, we now have 10 Pennsylvanians who have tested presumptively positive for COVID-19. We announced a case previously. We have 3 more cases. 7 are from Montgomery County. We have the previous cases, 1 in Delaware County, a new case in Monroe County, and the previous case in Wayne County. 2 of the Montgomery County residents and 1 Monroe County resident are currently hospitalized. You know that 1 Montgomery County resident is currently at the hospital of the University of Pennsylvania. For the other 2 patients that are hospitalized, we will not be releasing the names of the hospitals to protect their privacy and their confidentiality for themselves and the hospitals. We are hoping and praying for their recovery. While we are waiting for the CDC confirmation of these results, we're treating these cases as presumptively positive for COVID-19, and we are taking all appropriate public health actions. This includes what we call contact tracing. Contact tracing means that we are reaching out to anyone who came into direct contact with these individuals to see if they have developed symptoms and if they need to be tested. We are in constant communication with our county and municipal health departments across the state, including Montgomery County. I would really like to thank our partners in the county and municipal health departments for their work in keeping Pennsylvanians safe. We expect more cases to be confirmed in the upcoming days and weeks, but we want everyone to take action to prevent the spread of this virus, COVID-19. Really, since the start of the flu season, we have really been pushing out the same message. We have encouraged Pennsylvanians to stop the spread of illness by washing their hands, washing your hands for 20 seconds with warm soap and water, the time it takes to sing Happy Birthday twice, covering their coughs and sneezes into your elbow, cleaning surfaces, and please, if you are sick, please stay home. These are now the same healthy habits, the same practices that people should continue with yourself and your family to protect yourself against the spread of COVID-19. It's also important to get information about the virus and how you should respond from reliable sources. Social media is a way to share information quickly, but the information is not always a trusted source, as we know on social media. For the most reliable information related to Pennsylvanians' response, please visit our website at health.pa.gov. healthpa.gov. We continue to have the latest information, tips, and preparation checklists on our website. It's also for national and international information, good to check the CDC website. As this situation evolves, we will continually update Pennsylvanians through our website, through our social media accounts, Twitter and Facebook, on the latest information that is occurring in Pennsylvania. At this time, we are not recommending canceling social gatherings. But please, if you are sick, do not go to a social event with lots of other people. Please stay home. If you are sick, please stay home from social events. Please stay home from work. Please stay home from school. If you have questions about your health, contact your health care provider. We have been updating health care providers on a regular basis and how to assess patients and information about testing. What is most important for Pennsylvanians is to stay calm. We have the collaborations in place. We have the networks in place to ensure that we will continue to make Pennsylvania a healthy place for everyone.
Next question. Can you confirm, was the doctor at CHOP one of the?
We're not really, so, because of our regulations and our concerns about confidentiality, I know that, the other sources have discussed information about specific patients. We are not confirming or denying any of that specific information. We are confirming that there is a resident of Montgomery County that is hospitalized at the University Hospital at UPenn.
Are all the new cases adults, ages? Can you give us an age range of what we're looking at here?
The new cases are adults, yes.
Okay.
Could you give us a timeline on how long it'll take to get the results back from at least those initial cases in Delaware?
Again, those the ones that I have given you information about, and we have in previous press conferences and press releases, are presumptively positive at our lab. I don't have an exact timetable throughout the entire United States. All presumptively positive tests are sent to the CDC for confirmation. So our tests in New Jersey and in Maryland, et cetera, they're sent to the CDC, the samples themselves, for confirmation, but I don't have a timeline on when we will get those results back.
You said that the two Monco residents had traveled out of state previously, and that's probably where they got it. Do you know the source for these new cases?
Travel related.
International travel?
For one of the cases, international travel.
Other ones coming into contact with someone who was in contact with someone else?
That's correct.
All the cases we have so far, presumptive cases, are in the eastern part of the state. Can you speak to that, just about how maybe why it's over on that part of the state and not out west?
I don't think there's any particular reason why there's more in Montgomery County than in other places. We have more people in Pennsylvania that live in the southeast, and so it's not surprising that we'll see that. But we will not be surprised to see cases in other places. Again, we have a patient in Wayne County, and we now have a patient in Monroe County. So there's no particular biological reason why it's in the eastern part of the state, except more people live in the southeast.
Why do these tests have to be confirmed by the CDC?
That is their requirement. Is they want to make double and triply sure that all the labs, everything's functioning well throughout the entire United States, and so out of an abundance of caution, they're confirming the tests. We have not heard of any tests from any of the states that has been wrong in some way, and so I think it's just to be sure.
Are they redoing the test on?
They will take some of the solution from the sample, and they will redo the test. But I think it's just to be sure, and we expect that our tests, like other tests in the states, are positive.
When you say adult, I mean 30 years old, 70?
We're not going into that information because you can understand from a patient privacy point of view and confidentiality, I mean, it's very challenging. So, of course, you have to remember that all of these patients, well, 3 are hospitalized now, but the other patients are quarantined at their homes. And so they pose no risk to the public. And so we don't want to give identifying information. That's also part of our regulations for the Pennsylvania Department of Health.
When it's time to admit people who might have a COVID-19 case, Are there specific health facilities that are able to accommodate that, or should all medical facilities within?
We expect that all medical facilities will be able to treat these patients and to be able to provide the necessary protections for healthcare personnel. So unlike Ebola, where specific centers were identified, we expect that any healthcare facility should be able to care for these patients. If a patient, however, like any other very sick patient, if a patient is very ill and needs to be transferred, then they would be transferred. And as it is for any patient who might become very ill. All the hospitals are taking all the necessary precautions to prevent spread of illness to healthcare personnel.
Dr. Levine, just talking about these numbers, I know we're in the early stages of this. Every day we can't keep counting, I guess, and have a press with 8, 9, 10 people. When do you think we'll get to a point where it maybe, I don't want to say calms down, but there won't be a need to kind of address each case as they come up, county by county?
Right. So we plan to have actually regular press conferences to update you. One of the things that has happened in other states, so we will see if it happens in Pennsylvania, but it won't be surprising, is what we call community spread or community transmission, where it's not travel related, or it's not someone who was a close person, a close relation or contact of another case. They're just in the community and it's spread. And so that has occurred in California, that has occurred in Washington State, that has not occurred to date in Pennsylvania, but it won't be surprising. And so, yeah, it could get to a point where we don't have a press conference with every new case, but we plan to have actually regular press releases and press conferences anyway to make sure that Pennsylvanians are kept aware of the current events in Pennsylvania associated with COVID-19, and again, to reassure everyone in Pennsylvania that the Pennsylvania Department of Health, working under the governor's leadership, is prepared for COVID-19. I update the governor every day. We have regular regular senior staff meetings every day. We have collaborations with other departments, with our community and municipal health department partners. And so we are all coordinated, and Pennsylvania stands prepared.
Just to kind of piggyback on my last question, I don't want to misquote you, and I want to make sure I understand. If they need to be transferred to a different facility, is that because one might have more resources or more staff?
Yeah. So as any patient who might be at a hospital, if the patient gets more sick, and say it's a patient with very serious heart disease or kidney disease or whatever, and they need to go to a tertiary care medical center, they'd be transferred. So if a hospital feels that they cannot provide the level of medical care that is necessary for a patient, then they'll transfer the patient. That could happen here, happens for many conditions.
Can you give us some idea how these patients are being treated? Are they on breathing machines?
So I actually don't have all the specifics in terms of how they are being treated, but of course they are in isolation. Personal protective equipment is being used to protect healthcare personnel, and these patients will receive all necessary care, and again, we pray for their recovery.
Is there going to be a minimum set of symptoms to be admitted to the hospital? I think that they might have overcrowding and panic.
Right. So a patient would be admitted not just because they have COVID-19. So if they have mild symptoms and they're medically stable, then they'll be sent home for isolation and quarantine. So I don't have a specific minimum, but it would be if they require inpatient care. The way any patient might require inpatient care, a patient with influenza or something like that. So if they require oxygen, if they require intravenous fluids, if they require any type of that support, that would require hospitalization.
Any other questions? Well, just with the Secretary of Education here, are there any plans in Pennsylvania to discuss possible closures of school? Or, I mean, I know we've had some in Bucks County, but
I understand. Secretary Rivera.
So first, thank you for the question. We're here today with Dr. Levine just to show the coordination that exists between the Department of Education, our Department of Health, and PEMA. We've been communicating with intermediate units and school districts practically daily. And I think it's probably most important to reassure communities that from the beginning of the year, school districts have emergency preparedness plans in place. What they would have to do is customize them to meet the current need at the time, and school district administrators and their communities are working diligently to update their plans and make sure they're putting their best foot forward to address the issues we're presenting to them.
All right, thank you, folks. If you need any follow-up, please feel free to contact the Department of Health. We're here with FEMA, and we're operating 24/7.
Thank you.
Thank you.